You wash your hands, try a smoking jacket, only smoke outside, not in the house, not in the car, and so forth. So getting into alcohol, fetal alcohol syndrome, one of the most common identifiable causes of mental retardation, also called ID or intellectual disability. No amount of alcohol is safe. We do know that if a woman is daily binge drinking, fetal alcohol syndrome, if not death, is in that child's future. But mild to moderate drinking is less clearly understood, so all the more reason to avoid it, because ultimately, just because you don't see it as an effect on the child doesn't necessarily mean it's not there, and we'll talk more about that too. So damage can occur at any time during the pregnancy. It's not just early on. And diagnosis, which we'll get more into, diagnosis of fetal alcohol syndrome is a compilation of things, primarily growth deficiency or growth retardation, classic facial features, which we'll go over, and central nervous system structural and functional abnormalities. You may or may not have a history of prenatal alcohol exposure. Most of the kids that I have with FAS we have known that mommy drinks alcohol, and sometimes we know because she already has a child with fetal alcohol syndrome. Or, you know, there were police involvement or drug tests and other events during the course of her pregnancy where we were aware that she was using alcohol. So getting more into fetal alcohol syndrome, there's these classic facial features. The characteristics include a small head circumference, a flattened mid-face, so and the characteristics of that flattened mid-face are this sunken nasal bridge right between the eyes right here, a flattened and elongated philtrum. So if you run your finger over your upper lip, it has these this little divot, these kind of two bumps on it, and that's a normal philtrum. Everything in medicine has